Hey guys, Dr. Jordan here. I am going to be doing the presentation right now on ethics. This is going to be a fairly short presentation, but it's just a brief overview about what ethics is about. We're going to be talking more about this next week when I come back to class. So I hope you enjoy your day off. I will miss you. Be thinking of me, and let's get started. Okay, so the first thing that I found is that some students may have a little bit of difficulty trying to figure out what is the difference between confidential and anonymous. So, what I do is I have some scenarios here, and what you're going to do is you're going to just identify if the scenario that I share with you is confidential or anonymous. Okay? So when we talk about confidentiality, it's basically when somebody participates in a confidential test or a research project or a crime investigation. These are all things that are we think of as being confidential. We when somebody needs to provide personal information about him or herself, um, as we do in therapy, people are giving us information about themselves. We want to make sure that we keep that confidential, that we don't share that with people who are not directly involved with the client or the person. Um, Information such as phone numbers, names, addresses, date of birth, social security numbers, things like that. These are not to be given out to anybody not involved in the project, not involved in the testing site during research, not involved with the organization, or not involved with the client themselves. On the contrary, when we talk about being anonymous, this is when an individual really gives no personal information about themselves. And they should not be asked for specific personal information that would give their identity away. If a person needs to follow up or retrieve medical results or information that was provided in an anonymous way, usually a unique identifier, such as a number or letters, will be given that the person can then link into in order to get maybe the results of an assessment or a test or a checklist or something that they've done. So here are some examples, and I'm going to have you just determine which is anonymous and which is confidential. So of these two, leaving an unsigned note in the principal of the school's mailbox about something that was observed happening in the classroom is an example of anonymous or confidential. Meeting with your advisor to share that you have witnessed cheating in class could be an example of anonymous or confidential. Sending a text message to the site that you're interested in attending for a field period, but you forgot to sign or type your name. That is an example of confidential or anonymous. You are shadowing at a field period site, and you want to know more about a 7-year-old boy that you're working with. You arrange to meet with your supervisor at the end of the day in a private office to discuss him. This is an example of anonymous or confidential. A staff member writes a specific diagnostic test or diagnosis next to a patient's name on a communication board that's visible to clients or visitors on the patient unit. Is this anonymous or confidential? Every 6 weeks, the practice holds a vasectomy clinic. Normal Saturday morning surgery continues as usual. Patients for both clinics come along and book at the reception and take a seat in the waiting room all together. No one is aware that there are 2 clinics going on at the same time. Nothing is advertised to say that there is a vasectomy clinic taking place that morning. Would this be an example of something that is anonymous or confidential? You leave a note on your professor's desk explaining that the work is too hard. You do not leave your name and do not receive feedback on your note. This would be an example of anonymous or confidential. Derek is an EMT. He was on call and identified the patient as his mother's neighbor, Sally. He does not tell Sally that he knows her. This is an example of anonymous or confidential. Still talking about Derek. He's an EMT. He's on call and identified the patient as his mother's boss, Tom. He does not tell his mother that he saw Tom. This is an example of anonymous or confidential. It would be best practice to practice blank, fill in the anonymous or confidential here, when talking to your advisor and professor about something sensitive that is happening in class. All right. Now we're just going to introduce some ethical problems and then ethical principles. When we talk about ethical problems, I'm sure you've heard the term that, that's not ethical or it isn't ethical. Well, ethical problems can be divided into three different areas. The first is an ethical distress. This is when situations challenge the person's professional integrity. It could be the individual or as an occupational therapist. Okay, we'll talk more about this in class next week. The next is an ethical dilemma. This is when you have two or more ethical principles that collide with one another. Sometimes it's really difficult to determine what the best action is. That's when we have the dilemma. So it's two or more ethical principles collide. The third one is locus of authority. This is understanding the decisions about who should be the primary decision maker or who is the ultimate person that is responsible for the situation at hand. I'm going to come to class prepared with some examples, and we're going to have time to talk amongst ourselves and in small groups in order to determine and totally integrate what these ethical problems stand for. So we'll talk more about it later. The next area are ethical principles. Okay, we have autonomy and confidentiality, veracity, privacy and confidentiality, beneficence and non-maleficence, fidelity, and procedural justice. Again, we're going to be talking about each one of these much more in depth and much more so that you understand this information much better. Please be sure to read, it's posted on Moodle. It's the OT Ethics, and it also can be found on, the Code of Ethics for Occupational Therapists. This also can be found on the AOTA website. I want you to look that over because we're going to be referring to that as well next week. Okay, which brings me to this. So we are not going to be having a debate in this class. However, we will be talking about what a debate looks like. And we may do one mock debate in class. But next week when we meet, we're going to finish up the ethics lecture. Unit 3 exam is going to be on October 24th, and that will cover all the information from the activity analysis, the OT practice framework again, and the lectures on ethics itself. Then we're going to, your second activity analysis will be due by Sunday, October 27th at 11:55 p.m. Again, you'll be uploading that to Moodle. Please hold off on completing your activity analysis until you receive feedback from me on your first one, but certainly you can get started on that second activity analysis. The directions and instruction are posted already on Moodle. Basically, you're going to be selecting an activity that you want to analyze, and you'll be completing the same template that we did the first time. We will not be using peer feedback on this, so hopefully the feedback you received on the first one is enough in assisting and helping you move forward. I hope that you guys have a great day. I will miss you tomorrow. If you have any questions, please email me or text me, and I will get back to you on my breaks or in between my travel times. Okay? Have a great weekend.